legal, health, financial, and home improvement. Enjoy being educated in such topics as personal injury law, community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Good evening. This is the Ask the Experts radio show. I'm host Steve-O. We're on every Monday and Thursday night from 6 to 7 p.m. And we have the top experts in South Florida. And for you, mostly our men tonight, great show. He's been with us for about the last year. Broward Urology Center, Dr. Eric Shinven, and I got to tell you, we got a great show tonight. Hi, Eric.
Hey, Steve. How you doing?
Wow, your microphone sounds great tonight.
Nothing different. Must be a good connection. You were echoing a second ago.
Yeah, I know. We just fixed that just a minute ago. So, how are things with COVID?
Things are running full speed. We're busy. We're running into the hospitals, which are back busy, and at least thankfully for us here in South Florida, not crazy busy with COVID. Definitely a little busier, but just kind of full speed with surgery and inpatient visits in the office and kind of business as usual. I can't hear you.
You do cancer? Can you hear me?
Now your mic just went back on.
Okay. So you do a lot of cancer work too.
Sure.
But you do other surgeries. Are those considered electives?
Cancer surgery is most of the time it's elective, but
Okay.
elective but more urgent. And again, certainly back in March and April, we were putting off most of those surgeries that are not going to change things unless someone was bleeding or really having some life-threatening issues. You know, prostate cancer is one of the slowest growing cancers known to mankind, so usually affords us time to deal with that. It's really not going to change the outcome or the prognosis.
Well, the reason I brought it up because we're starting to hear now that hospitals are filling up, and is that the case?
You know, in Southern California, which I hear is surprisingly, for as crazy as they've been, where no restaurants are open there right now, still they are inundated with people. I think probably just going out on their own to house parties and stuff like that, just frustrated because they can't go anywhere. Yet here, it hasn't been so bad, but we were, I think, last week, up to about 40 patients at Broward Health Medical Center, the level 1 trauma center in northern Broward County.
Okay. Well, tonight we're going to be talking therapy for sexual and urinary dysfunction. But before we do that, because we get new listeners every week, tell people about your practice.
So we are Broward Urology Center. We are in, I guess you would say, the north or mid-east corridor of Broward County in southeast Florida. We are a general full-breadth urology practice. It's myself, Dr. Yovel, our senior partner of over 30 years, and Dr. Borbati, who joined us in 2012 from his robotics fellowship. He's a robotic surgery specialist. And we have our brand new office, 1.5 years now we've been in this office, our new state-of-the-art, clean, lovely office, not too far from Broward Health Medical Center, actually down the street.
You know, when people say, I don't know a urologist, I want them to think Broward Urology Center. And you get patients from Palm Beach too, is that right?
We see most of our patients, of course, locally, but
Right.
certainly Southern Palm Beach, Boca Raton, Delray, Boynton, I have patients come down. And since I've been doing the sexual medicine and really focusing a lot of my practice on that, I've really taken on patients from the west coast of Florida, northern Florida, way down to Miami, southern Florida, and I've had some patients fly in from out of state as well.
So Eric, you're like one of the top urologists in South Florida. What made you decide? Because I know this was not an afterthought, but you decided to go into sexual dysfunction. What made you decide to do that?
Well, I think as a urologist, we're subspecialty trained surgeons. We're all surgeons, but subspecialty trained in the genitourinary system. So we deal with male and female sexual dysfunction, erectile dysfunction, or ED, Peyronie's disease. We deal with low testosterone, overactive bladder, urine incontinence, and the urinary side of the genitourinary system, of course, too. And it's certainly a paucity of success that we were having, and sort of an open area for treatment and improvement in how we can help our patients. And that's what I saw. And as the newer technology was making its way, and I did give it a chance to really start to see some data and some results, and instead of just right off the cuff using this stuff 10 years ago, now that I've had the confidence and I've seen the data, I really think that I can add so much more into my armamentarium to not only just treat patients, but really treat them much better, much more adequately. Kind of like the satisfaction we get when we do a surgery and fix the problem.
Well, we actually had 3 people this week, because they knew you were coming on, as to Peyronie's disease. They want to know, how do you treat that?
So Peyronie's disease usually relates to a curvature of the penis that's generally thought to be from trauma or injury, most of the time during sexual intercourse, where the penis may get bent or snap, and yes, it can be to the point where it fractures and needs acute surgery, but generally not to that extent. And over time, there's some bleeding to the tissue and scarring, and that scarring forms a larger lump or a plaque. And that plaque acts as sort of a fulcrum where the penis can now, with an erection, kind of bend at that fulcrum and then start to contract. So the penis then not only with an erection, but all the time has a bit of a pull to one side, up, down, right, or left, or a combination. It can result in pain during intercourse, pain with an erection, and it's usually in relation to sexual function.
Well, what I love about what you do is there's a lot of people nowadays that have sexual dysfunctions, and that you hear ads on TV about a pill, and there's so much more to this. I mean, when they come in and sit down with you, there's a lot more than just giving them a pill.
For sure. And I think the nice thing is, I tell my patients with prostate cancer, the ones that have more lower grade and lower risk, and fortunately and unfortunately at the same time, there's a lot of options for that, but they have to make a choice. But it's always nice to have options, because you may have a number of reasons why many of those options are no good, and nice to have options. I think the same thing with, we're kind of focusing at the moment at male sexual function, but even female sexual dysfunction. And it's nice to have options. So maybe a pill is what's great and works for you, and that's terrific. But there are other options now. One of the things I wanted to bring up today is about the shockwave therapy. And this is something I've been doing for about 3 years now. And the shockwave therapy is something that is one of the regenerative types of treatments to regenerate or repair the tissue, to get it working back to its more natural state, hopefully completely, to the point where a man doesn't need a pill or an injection or a pump to have an erection, to have normal sensation in the penis, and to even help degrade and dissolve that plaque from the Peyronie's disease, so they don't have the curvature, they don't have the pain related to that. So what the shockwave therapy is doing is it's causing a bit of low-level trauma to stimulate the body's healing system. And it's not trauma to the point where we damage the tissue, but enough to kind of, what I describe as kind of shake up and agitate the cells. You kind of fool the body to thinking that there is some actual trauma, and it sets off that healing cascade, all the chemicals and transmitters that go in the system. And the platelets are usually the first line cell that comes in. Usually if there's trauma, there may be bleeding, so we need the platelets to plug up the blood vessels, but they also release a lot of these signaling proteins that stimulate other cells in the healing cascade to come in to help chew up damaged tissue if it's there, and as well as to start repairing tissue, even building new blood vessels. So it's
Is this
really
a
kind of cool
machine?
technology.
Is this a machine, Eric?
So it's a machine,
Okay.
and the machine that I've been using for up to literally about 2 weeks ago today is a radial shockwave device, which is a much smaller treatment head of a wand or a probe, sort of like a gun that we hold, and you hold on the penis of the tissue, and it's basically a piston-like, where inside the machine there's a small piston or metal bullet, as we call it, that fires up and down, smacking against the end of the inside of the probe, very similar to what would be like dropping a rock in a pond. And we see
Okay.
those rings, those are the waves, or those are the shock waves. That's a radio device.
Is it painful?
So the radial device can be, to some patients, and there's a wide spectrum of what people feel. It
Right.
can be uncomfortable to some, and so for the radial device, we do use topical on the skin numbing cream, and even if necessary in a small number of patients, I can inject and do a block
Oh,
to have that. So there are definitely some pros and cons to this original machine that started, and this is what most people refer to as the Gainswave. They popularized the name and this device, which is really a machine from Storz, a company that makes basically every urology instrument you can think of, all the scopes we use, and even the big shockwave machines for kidney stones. But the difference is the technology of that radial probe is quite different than the kidney stone shockwave machine.
is it a one-time treatment, or do you have to come back for more?
So, generally speaking, the shockwave treatment, when it's used by itself, there's a basic course based on the studies of either 5 or 6 treatments, depending on who you read and the long-standing data they've built. Again, Gainswave being one of the people that have kind of helped build the protocols, but now taking things further and growing on that. They are not urologists, but I find as a urologist, in my specialty and my expertise, I'm able to really analyze the data better and sort of take a treatment that was out there and hopefully improve upon the delivery, improve upon who, what, where, and when it's used than some of my other non-urology colleagues that have been doing the shockwave treatment. If we are using PRP, or the pink shot that we've talked about, which I'm not going to focus on tonight too much, I may, for guys with a mild dysfunction, use a single P shot with a single shockwave on the same day. And the shockwave is really to get the body's system stimulated to starting that sort of healing cascade. And when we actually inject the PRP, or the platelets that we get from the blood that we draw from that patient, then I feel like it gives us a little more of that natural milieu, that natural environment that's already starting to go, instead of just giving the platelets and letting them do their thing on their own without all the other sort of assistance that come in as well.
What are the success rates that you're seeing from this?
So the success rates that are reported are somewhere in the 75 to 80%
Oh.
range. But I think some of those older studies that were there also included that there was no stratification. So patients with very mild dysfunction all the way to patients with very severe dysfunction. And I think we have to kind of stratify the data to get a better expectation. Because like anything, it's going to be a little more difficult to treat someone who's had this for 15 years, who's a very horrible, difficult diabetic with severe vascular disease, versus a guy who's 45, 40, 50 years old with none of that and just some very early mild erectile dysfunction. Certainly in the guys with more mild dysfunction, I see amazing results, almost at 100%.
Wow.
As it gets farther and farther out, I think we got a direct treatment, which is why also, as a part of the workup, we'll do an ultrasound of the penis and really evaluate the severity of the function and sort of gauge treatment, because a single shock wave or a single course of 6 may not be enough. We may need to add PRP, increase the shock waves, and really customize the treatment to that patient based on their level of dysfunction.
Hey, Eric, we're going to go to break. Give everybody your phone number. They can call your office in the morning and set up an appointment.
Our number here at Broward Urology Center is 954-463-6408. Our website is browardurologycenter.com, and you can even find us on Facebook and Twitter as well.
Okay, we're going to go to break. We'll be back with Dr. Eric Shinven, Broward Urology Center, one of the top urologists in all of South Florida, and we'll be right back.
Are you suffering from erectile dysfunction, also known as ED? The urologists at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
We are back. This is the Ask the Expert show. We've been on for 5 years now, and we're on every Monday and Thursday from 6 to 7 drive time. Tonight we have Dr. Eric Shinven, Broward Urology Center. And Eric, we just got a text. You know, so we have a lot of mature listeners to the show. And we got a text from, and I'll give him your phone number. He wants to know, he has got high blood pressure, diabetes, and he's had erectile dysfunction for 15 years. And he wants to know if there's anything you can do for him.
Well, certainly the first thing is to evaluate him, take a good history, thorough history, physical exam, and certainly see where he's been just on the simple use of the oral medications and so on. And for some, that may be a start, certainly as a test to get a level of response and function for the erections. And then from there, we also want to check a testosterone level to see if his levels are low. You need to replace that, because that in and of itself may fix the erections and the erectile dysfunction. And then from there, we may get into, as I mentioned before, an ultrasound of the penis, and then move on to treatment. And that treatment, depending on what the patient chooses and seems most interested in, could be the pills, needle injections that are more direct stimulation of the erection and basically don't change anything, but like a Viagra or Cialis, they are an injectable medication that directly stimulate the erection. And then, of course, there are the regenerative treatments that we've been talking about, the shockwave, the platelet-rich plasma, or the P-Shot. And then, of course, if none of this works, or if I think the patient is really just no way going to benefit from any of these treatments, then our sort of final result is to move on to a surgical implant, usually an inflatable type of implant, And while it may seem drastic or aggressive for the patients that have it, they're definitely very happy and have a reliable device that can help them to maintain their intimate life.
So there is some hope, because it sounded
sure.
like he was an older
More and
gentleman.
more every day.
That is wonderful. Now, on the success, what is on the injection? What is this? Is it the same with the injection as to the success rate? Everybody's different.
You mean the P shot injection?
Yes.
Or the, okay. I think the success rates are not so published and out there with the P shot. There's data is a little paused, it's more anecdotal and so on. Certainly comes from the doctor who developed that in Alabama, and it's been used time and time again, but I would quote you rates somewhere in that 70 to 80% range based on what I've been taught and experienced from others who've been using it for much longer than me.
What about the Urisoft machine? We haven't really talked about that.
So the Urisoft machine is probably one of the latest technological advances in shockwave therapy. And believe it or not, there are a lot of different machines out there, more than I even ever knew until I went looking further. But I saw this device at the Sexual Medicine Society meeting about 2 years ago, and maybe even 3 years ago, and I was just getting into the shockwave therapy and kind of knew what everyone knew about that Gainswave type of device or the storage machine. And so finally I went looking and ended up trialing the SoftWave machine. And the coolest thing about it is the SoftWave machine is a miniature version of the kidney stone shockwave machine. And actually this company makes a kidney stone machine as well. Same technology now. And the difference is the older shockwaves referred to as radial shockwaves. These are true acoustic pressure waves, sound waves, pressure waves, and so on. The same concept, same technology, tweaked a little bit here as for kidney stone. And getting into the physics of it, the curve and the shape of the curve and how the width of the curve is different for the SoftWave. It results in having more of a showering of the shock waves. And this company's SoftWave has a focused and their patented unfocused probe that creates a wider field of the shock waves instead of sort of focusing things more to pinpoint. We use a focused probe to treat more pinpoint problems like Peyronie's disease, the plaques. But the unfocused probe allows us to get a little more of a smattering and a spray at the shock waves to not traumatize the tissue too much. And what's some super cool stuff about it is, the depth of penetration of how far the shock waves go in the radio device, maybe a quarter or a half an inch. And of course, we're thinking the penis is not a very, very big organ like your leg or your abdomen. But when you think about it, also where we also treat in the lower part in the perineum, the crus, the root of the penis between the scrotum and the anus, the rectum. And that's where we want to get a better depth of penetration. This unfocused probe can go as far as 3 inches in. So we're actually seeing urinary function improve.
I'm squirming, Eric. I'm squirming.
A lot of these men that have erection problems, right? They're in their 50s, 60s, 70s, even 80s, and they have urinary problems. And by going to a deeper level to get in towards the prostate, the bladder neck, we're seeing some improvement happen, and there's studies going on right now of urinary function. And one of the other last cool thing I wanted to bring up is the radial device really just causes a direct effect and that trauma effect for the cells. Whereas ice can have that effect as well, but it's been studied that pressure wave, the very positive and then negative drop, creates what we would say a permeability, a leaking of the cells, releasing VEGF, that vascular endothelial growth factor that stimulates new blood cell growth. Nitric oxide, we know about dilation and erectile function and so on. And so it, in and of itself, is stimulating the system, the healing cascade to work. So it's more and even better. And the best thing about this device that I can tell you, because I've tried all these on myself, and you can use this for many orthopedic uses as well, and I got lots of things bothering me lately. That radio device, boy, did that hurt on my elbow. This is called the soft wave because we don't have to use that topical numbing cream. We don't use an injection ball. We use nothing, which means the patient has less time in our office. There's less reactions, and it's just a nicer, better treatment for the patient.
Well, we got to get out of here. This has been the most incredible show. We've gotten about 4 or 5 texts. Of course, we have some women that ask if next month you'll talk about women. But this is Dr. Eric Shenvin, Broward Urology Center. Give everybody the phone number, Eric.
It's 954-463-6408.
This is the easiest show of all of our shows to do. Have a good week, and hey, we'll be seeing you next month on Ask the Experts.
Look forward to it.
Thanks, Eric.
Take care, be safe, and get your vaccine.
Promise, if they don't recover monetary damages in your case, you will not pay any attorney's fees. Shane M. Farnsworth, VA, offers a free consultation to evaluate your legal case. If they take your case, they only get paid if they win. Whether you've been injured in a motor vehicle crash, slip and fall, workplace accident, or through the negligence of someone else, you need attorney Shane Farnsworth fighting on your side. Call now for a free consultation. That's 561-272-8337. You are listening to the Ask the Expert Show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 6 p.m. Now, get ready for more Ask the Experts.
Hey, we are back. This is the Ask the Expert Show. We are on every Monday and Thursday from 6 to 7 drive time. This is our 5th year doing Ask the Experts. And I got to tell you, this has been the last 3 weeks. I think Freddie's doing something. We are getting more text and phone calls from listeners than ever before. Tonight's next show, what I love about this is when you drive down the street, you are inundated with billboards, buses, cabs, personal injury attorneys. But you know what? You don't know who to go with. You have no earthly idea just because someone's on a bus or a billboard. So what we do on this show, we bring you the best of the best. And you know what? When it comes to when you're injured and putting money in your pocket, you want someone that you can count on, who's going to return your phone call. If you've ever had a auto accident and you try to get a hold of the attorney and a week later they get back with you, we have the best attorney, Shane Farnsworth, in not just here in Palm Beach, but throughout Florida, because he handles cases throughout Florida. But you don't have to worry about a billboard or buses or TV spots. Shane Farnsworth is without a doubt the finest personal injury attorney, and that's all they do. Good evening. Now, did you had to like that one?
That was a great intro. I appreciate it.
But you know what? It's true, though. I mean, people are inundated with billboards and TV spots and, I mean, everything. But that doesn't mean they're a good attorney, you know, and that's what's so great about this show.
Yeah, I mean, just because you're on the billboard doesn't really give you any feel for how the person practices law and how receptive they are and how they deal with clients. That's something you only get through actually speaking with an attorney and developing that relationship and rapport.
That's very true. So tell everybody, how long have you been practicing, Shane?
I've been practicing for 22 years.
And your office is in Delray, but don't let that, I mean, if you're in Miami or if you're in Orlando or Jupiter, it doesn't matter because you're doing most of your business now by Zoom.
Yeah, primarily our cases come from Palm Beach County. We're in Delray Beach. My office is across from the IPIC Theater, if you know where that is. But most of our cases are South Florida cases, but we do cases throughout the state of Florida. In fact, we recently filed for the first time cases in Flagler County and Lake County. So we've added those to the list. But this show is primarily geared towards the people who are more local to our office. But like you said, with the pandemic, we've become accustomed to doing a lot of things either by phone or by Zoom. So we're able to keep in contact with our clients, keep them up to date, and to do that without necessarily having to come into the office. If you want to come into the office, we are open and we do see clients. But if you're not comfortable, we can see you other ways as well.
Shane, can you turn your volume down a little bit? We're getting a little feedback here. That'll absolutely help. So tonight,
Sure, is that better?
A little bit more?
More? Okay.
Okay. So tonight, we're talking auto accidents. And we're here in South Florida. Traffic's back now. People are back at work. Auto accidents. And you know what? If you've never been in an auto accident, you probably don't know what to do. And that's what the show is going to be about tonight, is what do you do? We're going to talk about insurance, if you've got injuries. Because, listen, we know that sometimes the injuries don't show up for a couple days. And it's really important when you have an auto accident to get somebody to represent you. And don't worry, because the way Shane's fee structures are set up, he only gets paid if you get paid, unless you have to go to court.
Yeah, that's correct, Steve. If you call us with a case, our initial consultation on personal injury matters is free, so that doesn't cost you anything. And if we have to, if we are representing you, it doesn't cost you anything unless we collect money for you. If we collect anything for you pre-suit, we get 33 1/3% of what we collect. And once you file the lawsuit, we get 40%. It's governed by the Florida Bar, so we use the same contingency fee agreement as everybody else. Those are the fees they allow us to charge. But if we don't collect anything for you, it doesn't cost you anything.
So, Shane, it's actually worth it for somebody who's in an automobile accident, because you've seen everything. And you can actually tell them if they have a case or not. But unless they come see you, they're never going to know.
Yeah, we're here to educate our clients when they come in. Whether or not we're able to help you or not, we're going to take the time to sit down, go through your situation, and decide what the best way is to proceed. We're certainly hopeful that when you do come see us, that the other party is going to have insurance, or you're going to have uninsured motorist coverage if they don't. If there is available coverage and you're injured, we'll do our best to represent you and get you the best result that we can.
So, Shane, how soon should they contact you after the accident?
My recommendation is to contact an attorney as soon as you can. Obviously, the initial thing you should focus on is medical care. If you're injured, make sure you get to the doctor. But once that's done, you should speak to an attorney. Once you have an attorney, what that does is it creates a buffer between you and the insurance companies. We then sort of step into your shoes and we handle the communications, related to your case with the insurance companies, and that helps to protect your rights and make sure you're not being taken advantage of, and make sure that, for example, that your personal injury protection benefits are being paid properly, or that, the other side is giving you fair value for your vehicle if your vehicle's totaled, or providing you, with a rental car if the car is being fixed. And we help our clients with all those aspects. And, the sooner we're involved, the sooner we can, number one, protect your rights, and number two, start to build the foundation for a successful case.
And this way, they don't have to talk to the insurance company. They have to go through you now. And it's so important. I cannot stress how important it is to have an attorney like Shane Farnsworth and not try to do this yourself, because it's not that easy. And Shane's been doing this for a long time, and there's questions that he will have that you might not even think of.
Yeah, I mean, obviously, being involved in an accident isn't something that occurs on a daily basis in most people's lives, hopefully. So you don't really go through this very often. However, we've represented, hundreds of people. So this is something that we do on a regular basis. It's something that we're comfortable with. It's we understand the situations. We understand how to make sure that your case is properly prepared, that the right people are involved, and that they're informed and know what's going on.
So, Shane, what's the first thing you do when a patient retains your services? I mean, a client retains your services.
Sure. When somebody comes in, one of the first things we do is we sit down and we discuss what happened in the accident. We want to find out, how did the accident occur? The first thing you have to do in a personal injury action is you have to show liability, that somebody else was negligent, and as a result, you were injured. So we need to know about the accident, the vehicles that were involved. If you have photos of the vehicles, that's very helpful. So, I always tell people, take pictures at the scene of the accident if it's safe to do so. If not, when you come to our office, we'll take the pictures. But yeah, once we're retained, the first thing we do is we send letters of representation to both your insurance company and the insurance company for the other party. With your insurance company, we're trying to make sure that your personal injury protection benefits are being handled properly. And we're also trying to find out whether or not you have uninsured, underinsured motorist coverage, which pays if the person who injured you either doesn't have bodily injury coverage or doesn't have insurance at all. With the third party, we're contacting that insurance company to look for bodily injury coverage. Bodily injury coverage is the insurance you buy, or if you're negligent and injure somebody else, that pays their damages. So that's initially what we do. Then what we'll be doing throughout the case is following you through your medical treatment, getting in touch with your doctors to request your medical records and your billing. So that way, when you complete your medical treatment, you've reached maximum medical improvement, and we're getting ready to draft your demand. We'll have your records and your bills together, so we're able to do that.
Shane, should everybody contact the police and get a police report no matter whose fault it is?
Yeah, absolutely. It's always unfortunate. People will come in and they'll say, well, I didn't get a police report, and then, but I had the person's information, and then you call, and the story that you get as to how the accident occurred from your client is the opposite of what the other person's saying. And if you don't take the time to get a police report and have them come out and investigate it and write what they determined to have happened, it's very easy for somebody to just turn around and say, I don't know what you're talking about. You ran into me.
Right.
You injured me, so I don't know why you're bothering my insurance company. So yeah, definitely call the police. Don't say we'll handle it amongst ourselves. It's not the way to do it. Take the time to call the police and get a report.
Yeah, I've had actually people say, "Hey, don't call the police. We'll get this settled out." But you got to call the police.
Yeah, and I've had people say, even when people weren't injured, they'll say, "Oh well, I'll pay to fix your car."
Right.
And then good luck finding that person.
Yeah.
After the fact, and your car never gets fixed. So yeah, most definitely contact the police and get a report. It's a very, it may take a little while, and it's an inconvenience to have to sit around and wait, but to have the documentation can be absolutely imperative down the line.
Well, we're going to go to a break, and we come back. We're going to talk about the no-fault law, because there's a lot of people who don't understand, especially with all the people moving down here, the Florida no-fault law. We're going to go to break. Shane, give everybody your phone number.
Yes, the phone number is 561-272-8337, and our website is farnsworthlaw.net.
I want to tell everybody this because you don't know when you're going to be in an accident. And I would hate, God forbid, someone's in an accident tomorrow and they go, what was that attorney's name? So write this down, 561-272-8337. And it's Attorney Shane Farnsworth. We're going to go to break. We'll be right back with more.
As an experienced personal injury attorney, Shane Farnsworth understands the key to success in your case. You are entitled to compensation for your injuries, medical bills, lost wages, and personal loss. Mr. Farnsworth will go to trial if you are not offered the fair settlement that you deserve. The law offices of Shane M. Farnsworth, VA, has established itself as one of the leading personal injury law firms in the South Florida area. They give all their personal injury clients a promise. If they don't recover monetary damages in your case, you will not pay any attorney's fees. Shane M. Farnsworth, VA, offers a free consultation to evaluate your legal case. If they take your case, they only get paid if they win. Whether you've been injured in a motor vehicle crash, slip and fall, workplace accident, or through the negligence of someone else, you need attorney Shane Farnsworth fighting on your side. Call now for a free consultation. That's 561-272-8337.
We are back. This is the Ask the Expert show. I'm host Steve O. We're on every Monday and Thursday from 6 to 7 with South Florida's finest experts. Sometimes they're not allowed to call themselves an expert, but I can. We're talking with Shane Farnsworth, one of the top attorneys in South Florida. And what a lot of people are moving down here now, they don't know what Florida no-fault law is, Shane.
Yeah, in Florida, we're a no-fault state. Basically what that means is regardless of who causes the accident, if you're injured, the first $10,000 of your medical bills is paid through your personal injury protection, known as PIP for short. So it's important to understand the PIP law because there's some caveats to it. Number one, if you don't treat within 14 days of your accident, you're not entitled to your PIP benefits. Number two, you pay for $10,000 in PIP benefits on your policy. However, unless you're determined to have what's called an emergency medical condition by a medical doctor, they cap your benefits at $2,500. Once you're designated to have an EMC, then you get the full $10,000 in benefits. Now, your PIP pays generally at 80%. So to make the math easy, if you go to the doctor and the bill is $100 and they submit it to your PIP carrier, they pay $80, and then you have a $20 your share of that insurance. So that's sort of the basics of PIP. It applies anytime you're involved in an automobile accident and you're injured, or if you're injured by an automobile accident, in cases like, for example, if you were a pedestrian or a bicyclist who's struck by a vehicle, your PIP coverage would pay medical benefits.
Yeah, we're talking auto accidents here, but you know, if you're riding a bicycle and get hurt, or you're a pedestrian, motorcycle, truck, you handle all that.
We do, yes. We're a personal injury attorney. We've talked about that before. That's sort of a blanket term. It sort of encompasses a lot of different things. We do auto accidents, slip and falls, dog bites, truck accidents. You're a pedestrian, a bicyclist. We handle those cases as well.
I wondered, because you just brought it up, your firm handles slip and falls, and is a slip and fall case tougher than an automobile accident case?
It all depends on the facts of the case. It can be at times because of the liability issues. For the most part, in an auto accident, it may be easier to determine if somebody's at fault. For example, if you're sitting at the stop sign and somebody crashes into the back of you, there's a rebuttable presumption under Florida law that driver in the rear is negligent. Whereas with slip and falls, for example, if you're in a grocery store and you slip and fall on a liquid, we may have to show that the liquid was there long enough that the store had enough notice that they should have cleaned it up. So, but it all depends on the facts of the case, and every case is unique.
So, with an automobile accident, they should come see you right away. What about a slip and fall? Again, same thing?
Yeah, that's not advice that's specific to auto accidents. If you get injured in any personal injury action, if you're a bicyclist, slip and fall, you get bit by a dog, the sooner you seek legal counsel, the sooner your rights are protected, and the sooner that we're able to make sure we secure any witnesses that there might be and get that information and, take pictures, of either vehicles or accident scenes or the crack in the sidewalk so we can preserve that evidence. And, that's all important stuff. And the sooner that we're involved, the sooner we can get that done.
Do you recommend especially for slip and fall or auto accidents, do you recommend a chiropractor or a doctor if you think they need to see one?
Well, for the most part, the medical treatment is something that we don't really orchestrate that. We essentially, stand by and they go to the doctors they feel comfortable with.
Okay.
There are a lot of people after auto accidents that treat with chiropractors or slip and falls. Oftentimes if there's, if they don't get better within about a month and a half, whether you're seeing a chiropractor or a regular medical doctor, they'll send you for an MRI. And if there's findings in that MRI, they'll send you out to a specialist, an orthopedist or maybe a neurologist. But that's sort of, we keep track of what's going on in your medical care. And if you're comfortable going to a chiropractor, then, by all means, they do a good job and they help people. So, the most important thing is making sure that your doctors have your interest in mind, that they're making sure that you get out for that MRI or get you to that orthopedist if there's findings in the MRI. So those are things we try to look out for.
I guess we can combine both auto accidents or slip and falls. How do most of these cases get resolved?
For the most part, personal injury cases get resolved prior to having to file a lawsuit. Most of them settle pre-suit. So that, and even if you have to file a lawsuit, the majority of those get resolved prior to trial as well. So I would say, the quick answer to that is most cases settle.
Okay, so I want you to understand something, that if you try to do this yourself, Shane's been doing this for so long, you basically know what you're going to be able to get out of the insurance company. You know what the injury is worth. If you try to do it yourself, you don't know this, and you could end up leaving a lot of money on the table. Is that correct?
Well, there's two things to that. One is that oftentimes insurance companies will contact people that have been injured by their insured very early on.
Right.
And they'll make you an offer to settle your case, and it's usually at an early juncture where you may not even know what's wrong with you yet. So
right.
If you go for that and you take that settlement, most often you're releasing that person who injured you from any further liability. So if you find out later on down the line that you have more severe injuries than you realized, then you're going to be out of luck. And we are able to determine approximate amounts for cases based on what the injuries are. But even with us, we have to wait until the case is done and the patient is finalized to be able to look at all the records and the bills to make that judgment. It's not something that, I've had people come in multiple times and in our first meeting ask, well, how much is my case worth? Or how long will I have to go to the doctor? And those are things that develop over time. There's no real answer to that. But you have to be careful. If an insurance company comes calling, they're doing that to look out for themselves. And if, like I said, if you have problems later on down the line, you're not going to be able to recover for those.
So what do you do if an insurance company doesn't offer you fair value?
Well, if we're representing a client and, we get to the point where we send a demand and, we have our evaluation as to what we think the case is worth. And if the insurance company, in our opinion, is being unfair or not offering, money that's sufficient to resolve the case, that's when we have to talk to our clients about filing suit. And that's generally what has to be done in order to try to move the insurance companies towards the value that we believe the case has.
And you actually lay out the case for the client. You don't make the decision for them. You just show them their different options they have.
Yeah, before we file a lawsuit, we always sit down with our client. We go over their medical history with them. We talk about what we think may be the pros and cons of their case. We explain to them the litigation process that they're going to be going through, because things change. When you're pre-suit, you're not really that involved. You're going to the doctor and getting well, hopefully, but you're not that involved. Once we file a lawsuit, things change. Now the defense, the insurance company, their defense attorney has the opportunity to take your deposition. They have the opportunity to send you to a doctor of their choice to examine you and give an opinion. You're going to have to go to mediation at some point before trial. And if the case doesn't resolve, you're going to have to go to trial. So it's a more intense situation for a client once a lawsuit is filed. We're certainly there to help them through it and explain it as it goes and to help them. But yeah, we sit down and talk to the client before the lawsuit's filed, because we have to make sure they're on board. It's their case.
So I know customer service is very important to you, and I love the way you explain it. Because I've talked to people who would call their attorney, leave a message. 2 weeks later, the attorney calls them back. Explain how your customer service works.
Sure. If you're looking for me on the bus that Steve was talking about earlier, you're not going to see me there. That's not where I am. I'm a small firm. It's myself, and I have a legal assistant who's very good at her job. And we make sure that our clients, if they call, they're going to speak to one of us for sure. If we're not available and you call before noon that day, you'll hear back from us. If it's afternoon, you'll most likely hear back from us that day. Well, if it's towards the end of the day, it may be the following day. But we are there to let you know what's going on, to keep you involved. We want to make sure you understand what's happening, that you're educated, and that you're helping us to build the best case possible for you. So, we're there. We're customer service oriented, and we make sure our clients know us.
Give everybody your phone number.
Sure. The number is 561-272-8337, and the website's farnsworthlaw.net.
And Shane will be back with us again next month with more Ask the Experts. Thank you, Shane.
Thank you, Steve. Bye now.
Bye.
Thanks for listening to the Ask the Expert Show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call